This is Jessica Miner, and this is my 5-minute video lecture on kidney stones. Kidney stones result from the development of crystallized material in the urinary system. Some terms to be familiar with: urolithiasis just means urinary tract calculi or stones, and nephrolithiasis just means kidney calculi or stones. There are several types of kidney stones that are defined based on the components of the stones, including calcium, struvite, uric acid, cysteine, magnesium, aluminum, and phosphate, with calcium being the most common. Kidney stones most commonly occur in those ages 20 to 60 years, but the incidence peaks from ages 20 to 30 years. The most common causes and risk factors include urinary stasis, infection, dehydration, diet high in calcium, sodium, or vitamin D, excessive excretion of uric acid, vitamin A deficiency, previous history of kidney stones, genetics, obesity, and sedentary lifestyle. Some key questions for the patient. First, what symptoms are you experiencing? Patients will often present with pain, and it's often acute, sudden, unilateral, and severe. Patients typically will present with flank pain, but the location of the pain depends on the location and the size of their stone. The pain can radiate to the groin or the general abdominal area. They may describe it as intermittent or colicky, but it can progress to constant and severe. Gross hematuria is often accompanying their other symptoms, and it's very common with kidney stones. Other associated symptoms are nausea, vomiting, and diaphoresis. Patients can also be asymptomatic, so keep that in mind. Number 2, have you or any of your family members ever had a kidney stone? Recurrence of certain stones can be 40 to 50% within 5 years, and family history is a risk factor, so you would want to assess that with a social history. Number 3, what is your typical diet, water consumption, and exercise routine? Patients with diets high in calcium, sodium, and vitamin D are at a higher risk for the development of kidney stones. Look for diets that include processed foods such as sandwich meats, canned soup, or packaged meals. Dehydrations and sedentary lifestyle are risk factors, so a decreased daily water intake and a decreased daily movement can place a patient at higher risk for developing kidney stones. Your physical exam and expected findings. First, percuss the costovertebral angle. Costovertebral angle tenderness will be present, and in the presence of these kidney stones, it can be unilateral or bilateral depending on the location. Second, palpate the abdomen. Patients will often have abdominal distension and guarding from pain referred to the abdomen, so it would be important to rule out other differential diagnoses such as GI causes for the pain. 3, auscultate heart and bowel sounds. Tachycardia may be present due to pain or underlying infection, and bowel sounds may be decreased or absent due to the presence of the severe pain. A UA should be performed, which will most likely be positive for blood, as well as visualizing the renal system by radiography or ultrasound. Most common treatment options. First, symptom management for stones less than 5 millimeters. They can actually pass spontaneously, and that's the goal. So you would just manage their pain with NSAIDs or narcotics and other symptom relief for nausea during that time until the stone passes. Second, there are non-invasive options if the stone does not actually pass on its own. There are several different ways that shock waves or ultrasound waves can be applied outside of the body to crush the stone. Medications such as tamsulosin or calcium channel blockers can improve the chance of spontaneous stone passing, but those would need to be in collaboration or physician actual prescribing, because those are off-label uses for especially the calcium channel blockers. There are invasive options that can be used in consultation with urology or nephrology, including urethral stone placement to facilitate elimination, removing the stone by incision of bladder, ureter, or kidney to remove the stone to prevent obstruction and infection. Patient teaching. First, they need to increase their water intake and eliminate carbonated drinks. Avoid high sodium, high calcium, and high purine foods. The goal is to prevent future stone formation. Second, they need to monitor their urine, including straining their urine with a strainer after symptoms are resolved for the passing of the stone. That is so that they can actually look at the components of the stone to prevent future stone formation to see what their stone was made up of. And 3, they need to increase their activity level to prevent a sedentary lifestyle, which can contribute to stones forming. These are my references, and thank you so much for watching.